discuss the results of a randomized phase 3 trial exploring maintenance therapy with the PARP inhibitor drug called Olaparib among people with pancreatic cancer who had an inherited BRCA gene mutation. You may not realize that a small percentage of patients with pancreatic cancer do carry the BRCA gene, and that turns out to be an important feature of this study. So please welcome Dr. Hetty Kindler, who's professor of medicine at the University of Chicago, to present the study.
It's my pleasure to present the results of the POLO trial to you today. Metastatic pancreatic cancer is a dismal disease. Even with modern chemotherapy regimens, patients generally live less than a year. Historically, most do not receive second-line treatment. There are no targeted therapies for this disease in a biomarker-selected population validated by a phase 3 trial. 4 to 7% of pancreatic cancer patients harbor a germline BRCA1 or BRCA2 mutation. They obtain an increased benefit from platinum-based chemotherapy. Maintenance treatments aim to delay disease progression following chemotherapy without compromising quality of life. Olaparib is a PARP inhibitor that targets cancer cells that have a defect in DNA damage repair. The study design for POLO is shown here. Eligible patients had metastatic pancreatic cancer and a germline BRCA1 or 2 mutation. Patients had received at least 16 weeks of a first-line platinum-based chemotherapy without progression. There was no maximum limit to the duration of chemotherapy. 38% of the identified germline BRCA-mutated patients had disease progression, were ineligible, or declined randomization. The remaining patients were randomized 3-2 to Olaparib tablets, 300 mg orally twice daily, or placebo, and continued until investigator-assessed disease progression or unacceptable toxicity. The primary endpoint was progression-free survival by blinded, independent central review. Progression-free survival was measured from time of randomization, which was after the completion of first-line chemotherapy. Progression-free survival was 7.4 months on the Olaparib arm and 3.8 months on placebo, with a hazard ratio of 0.53 and a p-value of 0.0038. This represents a 47% decrease in the risk of progression or death. The objective response rate by blinded independent central review in patients with measurable disease was 11.5% for placebo and 23.1% for Olaparib, which included 2 complete responses. Time to onset of response was earlier in the placebo arm, suggesting that these responses were a carryover from first-line platinum-based chemotherapy. What is truly remarkable is that the median duration of response to Olaparib in these patients who had metastatic pancreatic cancer was more than 2 years. In conclusion, maintenance Olaparib provided a statistically significant and clinically meaningful improvement in progression-free survival to patients with a germline BRCA mutation and metastatic pancreatic cancer whose disease had not progressed during platinum-based chemotherapy. Interim survival data showed no difference between arms. We are still awaiting final survival results, which will be evaluated at 69% data maturity. Maintenance Olaparib was well tolerated with an AE profile similar to that seen in other tumors. Health-related quality of life was preserved with Olaparib treatment and showed no difference between arms. Our results are the first from a phase 3 trial to validate a targeted treatment in a biomarker-selected population of pancreatic cancer patients, highlighting the importance of germline BRCA mutation testing in this setting. We conclude that a strategic approach of first-line platinum-based chemotherapy followed by maintenance olaparib treatment should become a new standard of care for patients with metastatic pancreatic cancer who have a germline BRCA mutation. Thank you for your attention.
Okay, well, that was some really exciting data that I'm quite sure will change the face of treatment for at least this population of patients with pancreatic cancer. So for some additional comments, I'd love to hear from Dr. Suzanne Cole, one of ASCO's experts.
I completely agree with you that this is a really huge step forward for patients with metastatic pancreatic cancer. This is the first time that a targeted medication has been successful in stopping the growth of metastatic pancreatic cancer in people who carry the BRCA mutation. More patients with metastatic pancreatic cancer who also had a BRCA mutation saw their disease go dormant and when they received the Olaparib. And at 2 years, 20% of patients were still alive with excellent disease control because they were taking the Olaparib. And now that we have a targeted medication that can benefit patients who have the BRCA mutation when they present with metastatic pancreatic cancer, it is our duty to search for this genetic mutation in all patients with metastatic pancreatic cancer so that we can identify those people who have the BRCA mutation and can benefit from being treated with an oral agent that can extend their life. And just to put this into context for you, I'd like to tell you about a patient of Dr. Kindler's who enrolled on the POLO study. He was diagnosed with pancreatic cancer, and at the time of diagnosis, it had already spread into his liver. He had inherited the BRCA mutation, as had his brother, and he had recently seen his brother die of metastatic pancreatic cancer within a few months of his diagnosis. And because this patient wanted to have a different outcome than what had happened to his brother, he decided to enroll on a clinical trial to see if he could get a better outcome. So he got onto the POLO study, he received chemotherapy for about 4 months, and then he was able to move over to the Olaparib, which is a pill, and he has now been alive for 2.5 years, and not only have the tumors in his liver stabilized, they've actually decreased in size. And he has had really excellent quality of life because he's been free of taking IV chemotherapy over this time. So I think this is practice changing for people who have the BRCA mutation. I can't wait to go back to clinic on Tuesday and look for it in my own patients. And congratulations, I think this is a fantastic step forward.
Great. Thank you so much.